Welcome. Hi, my name is Jim McGreevy, and welcome to Second Chances. And I'm really honored today to have an extraordinary person, a nurse, a healthcare leader, a CEO of a major hospital, my dear friend, Mary Ellen. Mary Ellen, could you tell us a little bit about the history of Clara Maass and how you came to this position?
Sure, Governor. Thank you so very much for inviting me today. I'm truly honored. I am a nurse by background. I have worked for the Robert Wood Johnson Barnabas Health System for over 25 years. I came to Clara Maass Medical Center back in '99 as the chief nursing officer and then chief operating officer, and to the current position now of president and CEO. The beauty of understanding.
So can you tell me a little bit about why you wanted to become a nurse?
Back in the day, when I was in high school, I was a nursing assistant at a nursing home. Not knowing what I wanted to do with my life, the staff said, "What are you going to be when you graduate?" I said, "I don't know, I'll be a nurse." And I was always in that caring profession, starting out as a nursing assistant with the geriatric population as a volunteer before I was an employee there, and really love just to take care of people, just part of who I am and what I do. So this was a natural progression. Went to nursing school at Muhlenberg Hospital, where your mom was a professor there, teaching the nurses down in Plainfield, New Jersey, one of the great nursing diploma nursing schools back in the
Back in the day.
Back in the day, and really loved what I did and carried on in various leadership positions.
Could you talk a little bit about the role of nursing? I mean, my mother used to say as a nurse, she taught more doctors measurement and dosage. But the role of nursing has really changed, hasn't it, over the last half century?
Yeah, it absolutely has evolved. And I think the ability to bring in all the sciences with nursing, the critical thinking that needs to go on for nursing, looking at the competencies nurses need to have today, and all the training and orientation that one needs to be able to function independently, the various opportunities for nursing that are out there to advance their degree. It's just a fabulous profession to be in, and you can go in all different directions from a professional perspective, whether it's nurse practitioner, clinical specialist, education, so many great opportunities for nurses to be whatever it is they want to be within this space.
So how has the role of nursing, it's clearly expanded with nurse practitioner,
Yes.
with increased education, with increased licensing. Has the relationship of the nurse changed fundamentally in the hospital system?
I would say there's more opportunities. Our nurses in the acute care setting still remain doing what we've done as a nurse from the very beginning. That piece has not changed. And also the humanistic side of what we do, but with the critical thinking.
And has the relationship between nurses and doctors changed, do you think? I mean, with staffing demands and requirements, my sense is, and maybe it's just optimistic, that the role of nurses have become more important, more potent, more of a hands-on as doctors are pulled in so many different directions. Is that a fair evaluation, or?
In the sense that we have allied health professionals, the whole workforce is difficult, whether it's a nurse, it's a respiratory therapist, a nursing assistant, physicians, and how do you supplement the workforce? And that lends itself to the different modalities that we have to support all the professionals in the healthcare field.
So, Marilyn, if you're looking at during the time of COVID, I mean, physicians, nurses, respiratory specialists, people were just literally worn down. Could you give a sense for our public? And you're incredibly hands-on, detailed. Our dear friend Phil Elijah and Joe DiFrancesco of Essex always extol your virtues. Don't tell St. Barnabas, but they prefer to go to Clara Maass. But could you talk a little bit about the impact of COVID on those healthcare professionals at Clara Maass?
I would say that not only at Clara Maass, but across the country,
Yeah.
Reality that we faced was something that nobody could ever predict. And I think that was the greatest concern when you go back and reflect on the entire experience and the lived experience. As a nurse back in the 80s, having gone through the intensity is not there, but still there with the AIDS crisis and all the death that I saw around me when it first came out. I was devastated as a very young nurse, looking at how can I help the people that I'm caring for as they were dying before my own eyes and in my hands, and waiting for me to be there in one case before they passed, for that just somebody to be there with them, just heartbreaking. And I thought in my life I would never go through anything like that again, and it still sticks with me today. And having gone through COVID and being here at this hospital and being with our staff day in and day out, this was something that you just couldn't predict. People did everything that they possibly could in the moment. Nobody had a playbook for this. And I would say that this every day I would come into work, I would pray before I got into work for our staff, our patients, our healthcare providers, the loved ones of the patients here. It was the most difficult time, I would say, neck and neck with what I saw back in the 80s. The lived experience has been harrowing for so many people, and difficult isn't even the right word. It was nothing that I would have ever experienced before. And I would say that most likely, if you ask for the narrative of the lived experience, you would hear the same words echoed across the country and even the world for those who went through it. It was devastating. The loss of life, it was just devastating.
As a CEO, I mean, when you talk about there was no playbook, and whether you read epidemiologists or CDC or look at trends, viral trends nationally, is there a takeaway on COVID that we learned? Is there a lesson that we learned that might be valuable to provide for better outcomes for the next pandemic?
I would say, from my perspective here at Clara, with our medical staff, the beauty that I experienced with them for the benefit of our patients is every subspecialist was tracking all the research every day as it remained stable or it changed. And our medical staff came together every single week to review what the latest trends were, because things were changing before our eyes. And they kept up with the latest research on what to do. They formulated a treatment plan of how we could provide the highest quality of care to our patients. And we enacted that. And we shared that with every physician in the hospital. So we knew what we needed to do. So if you were an internal medicine physician, the attending for a patient, and you knew there were going to be cardiac implications and renal implications and the infectious disease side, you all knew at the same time what we needed to do. And again, it was ever changing. So there were a lot of lessons learned. I mean, I think in the beginning they said you shouldn't take Tylenol or you shouldn't take Motrin. You shouldn't have steroids. Then the research, the literature changed and said, yes, you can have it. There were so many moving parts. And I would say the greatest lesson learned was bringing everybody together to understand what we needed to do at that time, in that moment, and how we could deliver the best possible care that we could. And the staff here that I've had the honor to be here with did the most incredible job with what they were facing. And I could not be prouder of our staff and everything that they did for our patients and their family members. It was moving. It was tearful. We had times where we cried together. There were times when we celebrated together, celebrated the life of people who survived this. We had a gentleman who was here with us on a ventilator. We didn't know if he was going to make it or not. His mother came to pick him up because he survived all the odds. To see the tears of joy from a mother to a son, and we were all there to cheer him on and to wish him well. And he came back to visit us. And you see patients, they were so sick, they were in the hospital bed. He came walking in to visit us. I think it was about 7 feet tall. And I said, and I'm 5'3". I said, let me just give you a hug. You go from one extreme to the other, and everything else in between. And it was just an emotional roller coaster for everybody. But the staff, the medical staff, the healthcare.
So how does, Mary Ellen, when you look at Clara Maass and you look at its response and its cooperation and what it did in Essex, how would you describe the for lack of a better phrase, the caseload of Clara Maass? Like during COVID, the whole hospital focused on COVID. But when it's not COVID, how would you break out the percentages of what hospital beds, how are they serving the public?
Sure. So relative to COVID, the whole hospital
just changed its mission.
Shifted. Yep. So where we have an IC, an intensive care unit, which the average daily census is about 18 normally, to manage those patients. We ended up with 64 ventilated patients that needed intensive
64.
care. 64. So surgeries were held off. We had many ICUs in the facility, looking for ventilators, which we received. We had. It was just incredible. So there was a big shift, and it took a while to get back to the normalcy. And I would say we are back in the normalcy right now. And we're where we need to be, doing everything we need to do, as we did for the community when we did have COVID. That has never changed whatsoever.
Interesting. And so when you look at COVID, you look at Clara Maass, one of the things that I think is really special, how Clara Maass stepped to the plate with New Jersey Reentry Corporation and the LeFrak Wellness Center to provide care, diagnostic care, the ability for individuals who are court involved to have access to these diagnostics. Could you talk a little bit about Clara Maass's vision and NJRC and the function of this partnership, where Clara Maass is providing top drawer financial through TD Bank, but it's also providing for top-notch diagnostic care through Clara Maass Hospital, and also we're providing top-notch training through the New Jersey Reentry Center. So you have all these disparate partners coming together to provide for a quality product. The section that you're responsible for is obviously Clara Maass, medical care and diagnostic care. But why are those diagnostic tests so important for people coming out from prison?
Absolutely great question, but I first and foremost have to thank you and your organization for all that you're doing for the people participating in your program. Without you, your assistance, the programmatic pieces that you've put together are paramount to make such a great difference in the lives of those who you are serving. And my hat goes off to you, your entire team. And to have the ability to listen to the lived experience of the people who are coming to you for a second lease on life, and really making a commitment to get better in all aspects of their lives. Incredible work. So for us to be able to partner with you, to understand the struggles that people come through your doors with, everything that's happened to them and how we can help them, when you understand what life has to be like for those who were involved in the justice system, the trauma that they faced prior to, the issues that they have, and when they're incarcerated, to understand what they're up against, not to have access to the health care that they need. I know there's differences between the men and the women that have been served by our justice system. Looking at
the argument is that many of the women are actually at a worse position because prisons are overwhelmingly designed by men for men, and women are increasing part of the prison population, but particularly when you have contracted health care, OBGYN, grappling with menopausal cycles, grappling with gynecological services, so many of those issues, bluntly, prison healthcare systems are traditionally not particularly well adept at grappling with.
Correct. And the relationship and partnership that we have with you in accordance also with the Robert Wood Johnson Barnabas Health System really looks at how we can be that first step for access to excellent health care with people who care about those who you are serving.
And I want to thank RWJ Barnabas, because RWJ Barnabas, through Clara Maass, has made a major commitment to working with literally individuals at the margins of life. And for the 21,000 individuals that enrolled in NJRC, the Reentry Corporation, Clara Maass, RWJ Barnabas provides a portal, a gateway to healthcare services that would not have happened but for you, Mary Ellen. So I'd like to thank the hospital.
Yep, it's a team perspective that we pull together. And I know when our team goes to the New Jersey Reentry Program, they are so happy. They tell me, Mary Ellen, we're going over to New Jersey Reentry today, and they want to do everything they can for those you're serving, and understanding that many will come with issues from mental health due to trauma. There could be substance abuse disorder issues happening, which I know we're working with behavioral health, peer recovery. They could have diabetes. There's
Okay, can we just talk about some
Yeah.
of these, right? I
Yep.
mean, 'cause that was the next on my list. So,
Yep.
when we talk about addiction
Mhm.
and you talk about the scourge of addiction, and between 74 to 76% of our clients have suffered from addiction and or alcoholism, another 42% co-occurring mental health disorders. And in the midst of the opioid crisis, we've adopted medication-assisted treatment, namely
Yes.
Suboxone,
Yes.
as a best practice.
Mhm.
And could you just talk a little bit, not only as a CEO, but as a nurse, as a healthcare professional, why MAT? Why medication-assisted treatment? Why specifically Suboxone or Vivitrol, or perhaps even methadone, should be, why that is so important within the context of opioid use disorder, treatment, stability, and if not, how do we re-understand sobriety, if we do?
Sure. And that whole component of substance abuse disorder is very, very complex. And we really want to understand it through our system specifically. We have many grants that we try to interface with people who have a substance abuse disorder. We have peer recovery counselors that are readily available, looking to be able to say, let's stop the stigma behind all of this. We're here to support you. We're not here to criticize you. Life is very tough out there. People all have different coping skills. People may not want to take a behavioral health medication because of the stigma, so they self-medicate with various different, whether it's drugs,
Substances, sure.
whatever substances. And the importance to give people the ability to function back in life. Of course, you want people to go to rehab, but the assistance through the medication treatment is paramount. There are many people that I know who are on Suboxone or the Vivitrol.
And could you
And
explain
it's
what
done,
Suboxone is, if you would?
I can speak
Well,
to it
yeah, but
minimally.
basically, it's a provision whereby the drug partially satiates the neural receptors in the mind to reduce the cravings of the individual, and indeed it makes it so much more difficult to be engaging in ongoing active addiction because of the Suboxone. But why does it, sort of, there's some pushback from people, and I have great respect, who traditionally look at NA, AA, and abstinence in all forms in terms of recovery. Why has the health community shifted, whether it's the New England Journal of Medicine or the British journal Nature? Why have they embraced MAT?
I think it's been an effective part of the treatment plan. All the other adjuncts to how we can help you get healthy, take control of your life, and help you work on your coping skills. If it's anxiety, depression, and if you're self-medicating, you don't have to go that route, because these medications are keeping you stable in the sense of those cravings, so that you can move forward with your life. There are you can maintain your job, you can keep your health benefits, you can live your life fully.
So it helps you to sustain healthy living.
Yes, absolutely. And it's part of that whole treatment plan, and there's absolutely nothing wrong with it. And it's always good to keep.
So you're out there with supporting NJRC with access to mental health, access to behavioral health, addiction, medical health, whether it's diabetes, whether it's Hep B, Hep C. What's been your greatest takeaway of working with NJRC and the people that Clara Maass serves? If you're looking at sort of the trauma in their lives, the chaos in their lives, and them and folks beginning to try to put their lives together in thoughtful and disciplined ways. What's had the biggest impact from your experience of working with the population we're privileged to serve?
I will say there's always the piece to take care of people, and that's what we do best. But hands down, anytime you ask anybody from the team that question, they are going to tell you it's not what we're able to give those who you're serving, it's what we get back from them. And the gratitude that the people we have worked with and encountered and to have taken care of, their gratitude is what fills our heart, what makes us want to keep coming back and keep on doing whatever we can do for you, and truly a labor of love. And to see, just to see their gratitude that somebody cares.
Well,
and
part of
somebody's
this is, and I
doctor.
apologize, but part of it is like people don't know that, hospitals, excuse me, prisons aren't hospitals, and prisons also aren't hotels, in the sense that you can't check in and you check out.
Right.
And that if you go to a hospital, say if you go not to a clinic within the prison, but if you go to a hospital, you leave the facility, you leave the institution. You lose your bunkmate, you lose your cell, and you start all over again from the beginning. So people, I think, naturally have a certain reticence, a certain reluctance to engage in healthcare because they knew what it cost them, what it cost them in terms of their cell, their cellmate, their position, whether they were out in the yard or whether they were inside the prison. So many people had, over the course of years, been getting closer and closer to a place that they preferred. And then because of a healthcare crisis, they would be flown by helicopter, by ambulance to a facility, and all of that would be washed away. So to have an institution like Clara Maass, where people are embraced, where they're treated with dignity, is such a turn for them. It's a 180-degree psychological turn, that causes them to be grateful.
Yeah.
I mean, have you seen that?
There's absolutely no question at all. And that for all of us is so, that makes everything worth it at the end of the day. And just the joy and that sense that somebody cares, and it's too, we need a picture to capture it, the essence of it all, but it's incredible, just incredible.
So I'd like to talk a little bit about a friend of both of ours, Frank Mazzarella, who was such a special person, and a special person in the life of the hospital, in your life, and my life. And his loss was somewhat sudden and sad. Could you talk a little bit about Frank, not only as a doctor, but as an administrator, and what he meant to the hospital?
Sure. He was absolutely my right-hand man. He was there for whatever I needed, whatever the hospital needed, held in the most highest regard by our medical staff. He was our chief medical officer for the organization for over 20 some odd years. Then he pivoted for us, looking at the key priorities in the hospital as the chief continuum of care officer and clinical services. And he was just, it's so sad not having him here with me, but through COVID, as you highlighted COVID, he and I were here walking the halls, being with the staff, seeing the reality of what was happening day in and day out. And I always said he was my work husband. And, I'm just lost without him. And he was so interested in, he was like, Mayor, we've got to do whatever we have to do to get a provider in and help the people with Governor McGreevey at the New Jersey reentry program. And he really was instrumental in helping us get this over the goal line. And I know we had been in conversation and we were like, how are we going to do this? We don't know. We're going to figure it out. And with
I know, and you've been,
umbrella,
Mary Ellen,
we
you've been
did it.
extraordinary because
We
you
did
get
it.
in there, you roll up your sleeves and you do it and you get things accomplished. And so like, if you can get through the legal department of RWJ Barnabas, you can get into heaven back and forth.
Yep.
But on a serious note,
Together, we made it happen.
I know, and I'm really
Happen.
grateful. I'm grateful for your engagement and leadership. I'm also grateful for the support of the county executive, Joe DiFrancesco,
Absolutely.
and on the Hudson County side,
Mhm.
Craig Guy, Phil Lodge, so many. So when you think about all that you've accomplished with Clara Maass, with the New Jersey Reentry Corporation, could you also talk a little bit about what you're doing in the community? I mean, one of the great things about Clara Maass is they're in their community, actively engaging. So you have an understanding of the hospital not only as bricks and mortar, but providing services that are community-based. Could you just, in the time left, could you talk a little bit about how Clara Maass sees its mission, not only as a physical entity, but delivering healthcare right where people are at?
Sure, and thank you for that question, Governor. We are more than the four walls in which this office and organization I'm sitting in. We are about keeping our communities healthy and bringing healthcare to them. We also really take a very strong look at the social determinants of health and how we at Clara Maass and also across the system for Robert Wood Johnson Barnabas Health, how we can be an anchor institution for those communities who need us the most. And we have done some really incredible things. One of the opportunities is our Center of Excellence for Latino Health, knowing back in the day that our growth in the Latino Hispanic community was growing. We had about a 15% population that we served. We are now up to 40%. It was at the time where people were really concerned if they were undocumented on what would happen to them, where one family member would decide to go get food, and in case anything happened, the rest of the family would be safe. And it was just heartbreaking. And we said to the community, we will bring healthcare out to you where you feel safe and where you have trust. And we went up to all the churches. We brought our healthcare community health team out to those locations that made sense for the community. And we opened our doors. I said, if you need more than what we can give you where you feel safe, we will pick you up, bring you here, and bring you back, because we don't want you to worry about that. You just come to us and let us take care of you. And that program has absolutely flourished. The trust that we have with the community, incredible. It took about 2 years to do that. And good and bad, the community, we have a community advisory board, and they said, Mary Ellen, this is the first hospital that ever opened up their doors for us. And
that's amazing.
to be able to have that, it makes the work all worthwhile.
That much better.
And even from social impact, again, as an anchor institution, we connect with Barringer High School, similar to what happened at West Side High in Newark. There was an issue with the students there that could not get their clothing cleaned. There were some issues of homelessness. We followed suit with what they did at West Side High, and we provided the washing machines, dryers, detergents, whatever was needed for the students at the school. We also do mentorship programs for the students to come here, expose them to healthcare careers. And we want to keep them healthy. And if they want to come and volunteer, we'll help them with college applications, we'll help them with job.
So where did you get this idea of a hospital as a community-based service organization? Because what you're describing is, I mean, obviously, when you're talking about the social determinants, you're talking about a much wider scope, a much wider practice than the traditional medical practice of the 1950s in terms of diagnosis, prescriptive action, execution. You're talking about something much larger, much wider, much deeper. And where did this come from in the sense of your own academic or programmatic or operational vision?
I think it's just a natural evolution with who we are as a healthcare system.
Do you think all hospitals have this?
I don't know, but I know for us at Robert Wood Johnson Barnabas Health that it's just a part of the fabric of who we are. Social determinants.
But clearly, though, hospitals can't. But hospitals can't cure all of these problems, and which I think goes to partnership, and why I think our partnership is so helpful, because I know I can't do diagnostic screenings, I can't do medical screenings, I can't do dental screenings, and that's why it's partnership. So when Mary Ellen looks at all these social determinants of care and looks at housing and general assistance and DVR and Medicaid and access to healthcare and Suboxone and MAT, how do you put that system together?
It's just part of our fabric. It's just what we do. There's not, you just do it because it's the right thing to do. Understand what the community needs are, how we can navigate, and as long as we can do it, we're going to do it. Community members, it's not me saying what a community needs. The community tells us what they need, and we go out and we meet those needs as best as we can.
That's tremendous.
With Newark Beth Israel, they've got a farm, and they were able to rally with the state for the SNAP program to be able to buy the fresh produce.
Yes. Farmer Darryl.
Farmer's market. Yeah, absolutely.
Farmer Darryl.
And those things are so important when you look at that. We also have community health workers that we have at Clara Maass and Newark Beth Israel that is specifically looking at an assessment on every patient that we interact with and evaluate.
And I would also want to congratulate you for the technological upgrades in the RWJ Barnabas system. In terms of medical records, in terms of data keeping, RWJ Barnabas as a system has really moved light years to maintain integrated file systems across the entirety of their network. Which is important.
Absolutely. And that way we can evaluate what those social determinants of health are, and the community health workers have all the resources that we need to.
But that's one of the things that we're plugging for, Mary Ellen, in terms of a health information exchange, particularly on the behavioral side.
Yes.
So if Jim McGreevy's in treatment facility A or B or C, sometimes it's so difficult to acquire that information, prescription and dosage. You know, was I on Suboxone? Was I on, Effixor? Was I on Seroquel? What were my prescriptions? What was the dosage?
Sure.
So there's not a complete profile. And where there is clearly at RWJ Barnabas, in terms of an integrated systems reporting mechanism, we find that out in the world of behavioral healthcare, namely addiction and mental health, so often that's lacking.
Yes.
And that's something we would ask, the governor's office, particularly the use of monies from the opioids court settlement, to be looking at developing health information exchanges so that we can have an accurate snapshot of what's historically been done at whatever hospital.
Yes. Yes. Very, very important. And we've seen the ability to understand a patient no matter where they are because of the the electronic health record that we have access to.
Yep.
It's
Yeah.
incredible.
So we're just wrapping up now, and so I just have to ask you, what's been your greatest joy and your greatest revelation as to being a CEO of a major urban hospital? What's been that? What's been the greatest joy, and what's been the greatest lesson?
I would say it's the entire healthcare team that do the most awesome job day in and day out. And to be able to still visit the patients, make rounds on the floors, interact with the loved ones and the patients, and see all the great work that goes on here. It's just phenomenal. And I give my hat off to all those that are here to support this institution and to support the system. And it's just great to be with our team. It's just, I'm blessed. I feel truly, truly blessed to have an incredible group of professionals here taking care of our vulnerable patients in the most needed times of their lives. It's just, it's incredible.
No, and I just want to say thank you, because what I walk away with, in addition to all your book smarts in terms of your medical smarts, what I walk away with is a great sense of caring, a great sense of compassion, and a commitment to get it done. And so, you know, the old expression, talk is cheap, as they say, and, you know, to walk the walk. But I mean, you sincerely walk the walk. And I'm grateful for the, you know, RWJ, Barnabas, the system statewide. But what Clara Maass has done in very tangible, specific ways is literally remarkable for people that are going through reentry training center, whether it's CDL, whether it's HVAC, whether it's phlebotomy, general construction, whatever. But Clara Maass is walking the walk in a real demonstrable way. And I know that would not have been possible without our dear friend, Frank Mazzarella, without your leadership as CEO and President, Mary Ellen. So I just want to say, you know, we talk about this week, you know, this week with Jim McGreevey's second chances. What you're doing is you're giving many people a first chance with regard to healthcare, particularly people that have come from the community, have become court involved, and never before had someone to give them a diagnostic blood screening for hepatitis B or C, giving them the benefits of so many women in terms of OBGYN examinations, so many men and women on diabetes. So I just want to say thank you to Clara Maass, because this isn't an academic discussion. I mean, if anybody's seen Mary Ellen, Francine LeFrak at the Wellness Center, you understand the grave nature of what's being done, the saving of lives, and the requisite gratitude by so many. So any last thoughts from our president?
Again, it takes a team, and I'm blessed. We are delighted and honored to be a partner with you in this journey. And we're always here for whatever we can do for you. And as long as I can do it, we're going to do it. But you're doing incredible, incredible work. And I thank you for all that you're doing to really make a difference in the lives of others. It's just, it's
well,
terrific.
Thank you.
And
for all the people who are coming home from prison that get to go through the Francine LeFrak Wellness Center and have access to a diagnostic exam by a Clara Maass physician, week in and week out, month in and month out, year in and year out, you're changing lives in demonstrable ways for people that are on the edge of society. So a big shout out for Clara Maass, member of the RWJ Barnabas family and system. And thank you very much. And all the best for a wonderful Christmas and a wonderful holiday.
And all the best to you and your entire team. And to those who you serve, we wish them a very prosperous and healthy new year. Thank you so much.
Thank you, President.
God bless. All
God
right.
bless.
Bye.